Good morning, Patrick. My name is Mihira. I'm your invigilator for the OIT speaking session on the 12th of September 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. May I know your full name for the record?
My full name is Patrick Sean.
All right. Could you please confirm your candidate number?
Yes. My candidate number is 2103200430.
All right. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Okay. Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
What is your favorite thing about being a nurse?
My favorite thing about being a nurse is the ability to make a difference in the lives of my patients. I love helping people through difficult times and seeing them recover and get back to their lives. I also enjoy the challenge of nursing and the fact that there is always something new to learn.
What are your career goals?
My career goal is to become a nurse manager. I am interested in leadership, and I am passionate about making a difference in the lives of my patients and colleagues. I plan to achieve this goal by continuing to learn and develop my skills, and by seeking out leadership opportunities.
What is your philosophy on patient care?
My philosophy on patient care is that every patient deserves to be treated with compassion and respect. I strive to provide my patients with the highest quality care possible, and I always keep their best interests in mind. I also believe in patient education and empowerment, and I work with my patients to help them understand their condition and make informed decisions about their care.
What is your experience with working with diverse patients?
I have experience working with patients from all walks of life, including different cultures, religions, and socioeconomic backgrounds. I have adapted my care to meet their individual needs by being respectful of their beliefs and values, and by providing them with information in a language that they can understand.
What is your experience with using electronic health records?
Electronic health records are becoming increasingly common in healthcare settings, so it is important to have experience using them. I have experience using electronic health records in both hospital and outpatient settings. I have found that electronic health records can be a valuable tool for improving patient care by making it easier to access and share patient information. I have also used electronic health records to create and implement individualized care plans for my patients.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hi, good morning. I'm Patrick Sean, one of the nurses in the Community Health Center. May I know the reason for your visit, please?
Hello, Patrick. Good morning. I am here to get some details of the DT vaccine for my child.
Sure, I am happy to help you. Well, could you please confirm her date of birth and any allergies she has?
Sure, she was born on the 15th of October 2023, and she has no known allergies.
Okay, thank you. How may I address you?
My name is Mihira.
So, Mihira, your child requires DT vaccine, which is for diphtheria and tetanus. Do you have any concerns or questions about this vaccine?
Well, I'm not very familiar with these diseases. What are they, and why does she need to be vaccinated against them?
Your question is reasonable. I will let you know in detail. Mihira, diphtheria and tetanus are serious bacterial infections that can affect the throat, lungs, nerves, and muscles. They can cause breathing problems, paralysis, and even death. The DT vaccine protects your child from these infections by stimulating her immune system to produce antibodies that fight the bacteria. The vaccine is very safe and effective, and it is recommended for all children as part of their immunization schedule.
I see. Thank you for explaining that. Are there any side effects or risks associated with the vaccine?
That is a good question, Mihira. The most common side effects are mild and include pain, redness, and swelling at the injection site, fever, and fussiness. These usually go away within a few days and can be treated with paracetamol or ibuprofen. There is a very rare chance of a severe allergic reaction to the vaccine, which can cause hives, difficulty breathing, or shock. Don't worry about it. This is why we monitor your child for 15 minutes after the vaccination to make sure she is okay. If you notice any signs of a severe reaction after you leave, you should go to the nearest emergency department immediately.
Okay, I understand. How about the needle prick? Will it hurt her a lot?
Your concern is understandable. We use a very thin needle, and we try to make it as quick and gentle as possible, so that she won't experience severe pain. By the way, Mihira, let me provide some tips to make your child comfortable for the vaccination. You can help your child by holding her close, talking to her softly, or distracting her with a toy or a song. You can also apply some ice or a cold compress to the injection site after the vaccination to reduce the pain.
Thank you for the tips. I hope she won't cry too much. Well, how many doses of this vaccine does she need, and when should she get them?
Mihira, I will provide the details of the vaccine she needs, and when she should get them. In total, she needs 5 doses of the DT vaccine. The first 3 doses are given at 2 months, 4 months, and 6 months of age. The 4th dose is given at 15 to 18 months of age, and the 5th dose is given at 4 to 6 years of age. These booster doses are important to maintain her immunity against diphtheria and tetanus throughout her childhood.
All right, thank you for all the information. You have been very helpful.
You're welcome. Mihira, here is a leaflet that has more details about the DT vaccine and what to expect after the vaccination. This would be helpful for you.
Yes, definitely.
All right. If you have any further questions or concerns, you can call us at this number or visit our website. Now, can I schedule your child's vaccination?
Yes, I think so. Please do it.
Okay, great. Her vaccination has been successfully scheduled now. Mihira, before concluding, let me summarize what we have discussed so far. Your child requires the DT vaccine, which protects against diphtheria and tetanus, 2 serious bacterial infections. The vaccine is safe and effective, and is part of the standard childhood immunization schedule. We discussed common side effects of the vaccine, including mild pain, redness, swelling, fever, and fussiness. Severe allergic reactions are very rare, and here at the health center, we will monitor your child for 15 minutes after vaccination. I also explained that the needle prick is made as gentle as possible to minimize pain, and provided tips to comfort your child during the vaccination. Your child will need a total of 5 doses of the DT vaccine at specific ages to maintain immunity against diphtheria and tetanus throughout childhood. You received the leaflet with more details about the vaccine, and were given contact information for further questions or concerns. Finally, your child's vaccination has been successfully scheduled. Is there anything else you would like to know or discuss?
No, that's fine. Thank you, nurse. That is the end of your OIT speaking role play, and best of luck.
Thank you, Mihira.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.